Hello, I'm Dr. Vikram. I am a physician at Manipal Hospital. Uh, and this video we are creating to create awareness about dengue. These days we are getting a lot of patients with fever. Many of them are dengue and many of them are not dengue. But dengue has created a big panic these days in the social media as well as a lot of households. So here are a few pointers how we go about dengue. First, what are the symptoms of dengue? The first and foremost is fever, second is body ache, and third is classic symptom is pain around and inside the eyes, which is called as orbital pain. Usually these patients do not have any other symptoms like loose motions or severe cough or burning urination. So this is when we think of a viral fever. Dengue is one of the viral fevers. Second is when to do dengue test. These days, the moment patients get fever, they come to hospital, they get the test done. On day 1 or day 2, many times the test do not reveal anything. That's why it is important, unless you have other symptoms like loose motions or burning urination or severe cough, wait for 2 days, see how the fever behaves, and probably on third day you do a dengue test and some other test. The test also, it is better to get them done after going to your doctor and whatever test he recommends, rather than going to lab, doing too many tests and getting confused. So it is better to do specific test told by your doctor. You must have seen a dengue test showing IgG, IgM and NS1. Now NS1, if it is positive, it means this is active dengue within 7 days. If IgM is positive, that means the patient had contracted dengue within last week to 3 weeks. And if IgG is positive, that means it's an old dengue infection. So if you get a report with IgG positive only, that means you had dengue sometime in past. This is not an active infection. Secondly, when do we admit patients? Patients are quite frightened, panicked, and they want admission as soon as dengue is detected. Actually, when do we admit dengue patients? There are 3-4 specific criteria. First is if you are unable to manage fever at home because there is no help with family members or friends, or there is repeated vomiting because of which you are unable to drink adequate liquids, or your platelet count drops below 50,000, or your hemoglobin increases by more than 2 of baseline. These are typical classic indications for admission for dengue. How many days of fever? What do you expect in dengue? Usually the fever will continue for at least 5 to 6 days and gradually it will settle. The platelet drop continues beyond fever and then it starts improving after 3-4 days of last episode of fever. Now which antibiotic? A lot of patients ask me which antibiotic and why not antibiotic. As you know, dengue is a viral fever. Antibiotics do not work. So there is no role of antibiotic. The typical medicines that we give is vitamin B12 supplementation because it helps in platelet improvement. And second is papaya leaf extract. Common trade name is Carepil. There are 2-3 other brands also. Now important is not to use a decoction made at home using papaya leaves because they are not standardized. You don't know how many leaves to take, how long to boil, how much to concentrate. Those things are not there. Instead, it is safer to take papaya leaf extract in tablet form, which is standardized at 1100 milligrams. Most important part is you do not fixate on platelets. See, we have to transfuse platelets if they drop below 10,000, which happens in less than 1% of the patients. Most of the patients will drop to 20,000, 15,000 and it will just pick up. Far more important is prevention of rise in hemoglobin. If your hemoglobin is rising, basically it means you are getting dehydrated and you are not able to drink adequate liquids. So it is much more important to monitor hemoglobin as compared to platelets. Prevention. Of course, as all of you know, prevention is better than cure, and simple prevention is preventing mosquito bites. Dengue mosquito can bite during daytime as well as early morning or late evening. So you have to take care during this period also. Use mosquito repellents, something like Good Night or Odomos or whatever you have. Avoid collection of water anywhere where the mosquitoes can breed. Is there any other prevention? dengue vaccine is still in pipeline, has not come into use. Once it comes, after proving the efficacy, we will be much safer. Till then, prevent dengue by preventing mosquito bites. Thank you.